It's available at her website, neatlittlernest.com. We have a link to the site at wcco.com/links.
So, I've got a question for you. What if you could watch all the CCO news you want and see all your favorite CCOers anytime, anywhere? Well, you can. Go ahead and grab your phone. Come on, I know it's close by. And go to WCCO.com or get the app. And poof, there we are, right next to all those other networks you stream. Bonus time, it's free. You heard right, zip nada zilch, for free. CBSN Minnesota, built by CBS News, powered locally by WCCO.
The American Red Cross urgently needs blood and platelet donations and asks all healthy donors to schedule an appointment to give now. With the coronavirus outbreak, it is important to maintain a sufficient blood supply. Your blood donation is critical and can help save lives. Please schedule an appointment today. Download the Blood Donor app, visit redcrossblood.org, or call 1-800-RED-CROSS today. You can make a difference.
Enterprise, come in. This is Spock, come in.
You gotta follow your destiny.
Afraid to Train, thanking you for joining us today.
This is a developing story on CBSN Minnesota.
Thanks for watching CBSN Minnesota. I'm Jason DeRusha. Once again, state health officials are giving us an update on COVID-19. Let's hear what they have to say.
This is being recorded. And now I would like to hand the conference over to your speaker today, Ms. Andrea Anneman. Thank you. Please go ahead, ma'am.
Thank you. Good afternoon, everyone. Thanks for joining us for the COVID-19 media call for September 28th. On the call today, we have Infectious Disease Director Chris Erzman and Assistant Commissioner Dan Huff. After some updates from our participants, we will open the call for questions from reporters on the line. With that, I will turn it over to Chris Erzman.
Thank you, Andrea. This morning, globally, we were at 33.1 million cases and 998,000 deaths. In the United States, we were at 7.1 million cases and 204,000 deaths. In Minnesota, we added 936 cases yesterday for a new total of 9,678 cases. The median age of our cases is 35 years old. We added 7 deaths yesterday for a new total of 2,015 deaths in Minnesota. 2 of these deaths occurred in residents of long-term care facilities. 2 were in Anoka and Ramsey counties, and 1 each in Hennepin, Clay, and Itasca counties. The total includes a person in their 90s, 1 in their 80s, 2 in their 70s, 1 in their 60s, and 2 in their 50s. A total of 7,546 people have been hospitalized since the start of the pandemic, with 2,111 of those in the intensive care unit. For a testing update, as I said, we added 936 new cases yesterday on a volume of 22,162 lab tests. But more significantly, we reached 2 million laboratory tests yesterday. So that is a positive milestone. This weekly change, the weekly change in cases is 7.4%. It's stable from yesterday and up from 7.2% last week. Weekly change in testing is 8.2%, which is up from 8% yesterday and 7.8% last week. The 7-day average testing positivity rate is 5.4%. That's slightly higher than yesterday at 5.1%, and from last week, 4.4%. We have been above the caution threshold for 2 days now. I'd like to talk a little bit about some of the workplace and social outbreaks that we're seeing. We're seeing more and more clusters of cases and outbreaks associated with certain settings like workplaces and social gatherings. Some updates on numbers that we've been seeing in workplaces. Then what we mean by that is a workplace with 3 or more COVID cases among employees. So as of today, we've had 89 case clusters in businesses that were regulated by the Department of Agriculture. So that includes places like veggie processing plants, dairy plants, bakeries, grocery stores, delis, and more. We've also had 40 clusters and outbreaks in meat processing plants, 182 clusters in manufacturing plants, and 246 in general businesses of all types. We're seeing more and more cases in people aged 20 to 40 years old. These are working age people, and it's important to note that cases associated with workplaces aren't necessarily due to spread happening in the workplace, but rather it's often an employee who gets exposed outside of work and then brings it in to the workplace. While you may feel healthy or are not worried about COVID, keep in mind that bringing the virus into a workplace means you could be exposing a colleague who could get very sick. This lines up with the fact that we are seeing more and more social outbreaks. As of September 24th, there have been 77 bar and restaurant establishments that have been investigated for possible outbreaks where COVID-19 was spread to patrons. 47 of those had enough cases to be counted as an outbreak. And what we mean by that is we release the names to the media. There are 1,416 unique cases that report visiting those establishments. We also continue to see outbreaks associated with events like weddings, funerals, gyms, and other social gatherings. There have been 37 outbreaks associated with weddings, 11 with funerals, 22 with gyms, and 62 with other social settings. One event can affect so many people. We are aware of another large wedding reception where someone attended while infectious, and as of today, there are 11 cases and 2 people in the hospital. It was helpful that the reception took place outside, but being outdoors is not a substitute for safe practices. It is essential that people still keep a distance and wear a mask. I just threw a lot of numbers at you. Numbers are important, but we can't forget that these numbers represent people. We're getting closer and closer with every passing day to having 100,000 cases. That's 100,000 Minnesotans. We already passed the sad milestone over the weekend by reporting over 2,000 deaths. Our friends, family, and neighbors are represented in these numbers. We've said it before, but we have to say it again. It's extremely important for everyone to do their part in helping to slow the spread of this virus. That means wearing a mask, keeping your distance, staying home if you're sick or if you've been exposed to a known case, and washing your hands often. This is our path to further opening the economy and our social interactions. Connecting with family, friends, and loved ones is important to our overall well-being, but please do so while following these recommendations so we can keep each other safe. And with that, I'll turn it back to Andrea.
Thank you, Chris. As we open it up for questions, we ask that reporters limit themselves to 1 primary and 1 follow-up so we can get to as many questions as possible. With that, with that operator, we are ready to take questions.
As a reminder, to ask a question, you will need to press star and then the number 1 on your telephone keypad. To withdraw your question, press the pound key. Our first question comes from Kate Radatz from WCCO Television. Your line is now open.
Thanks for taking my question. We're waiting to hear from President Trump. He's expected to speak really, I think, just within the hour here on a testing update at the federal level. Are you able to share of what you know? Are there any changes that could be happening within the state? And really, you know, if it's a case of more tests that would be coming to Minnesota, I mean, is that the solution to getting things, you know, how people want them back to normal? Is it just a matter of having more tests?
I can comment that there have there have been calls with leadership about additional testing becoming available and coming from the federal government. So we have heard some things about that. I will say that, testing is very much an important part of our overall strategy. And you certainly heard that, from Governor Walz and all of the efforts that have been made to make sure that Minnesotans have access to testing. But certainly testing is not the only answer. A big part of what is necessary to be successful involves not only identifying cases early and getting them isolated, but also making sure that people are following through on guidance. And we've certainly been hearing more and more that people are not doing that. So in other words, they're not staying home when they're sick. They're not isolating or quarantining themselves. And so that's a real problem. So while testing has a very important role to play, it's not the sole role in solving all of the challenges related to the pandemic.
Got it. And then second, on the testing front, Minnesota, we were over that 20,000 mark again. I think it was over 22,000 reported from yesterday for tests in the day. How are we doing on testing? And is that number where we want to be for the long haul?
Well, I think I'll see if Assistant Commissioner Huff wants to answer that question.
Yeah, thanks. This is Dan Huff. So we're really excited and pleased with the testing capacity that we have built in Minnesota. We achieved the $20,000 moonshot, but we know that that's not enough, as we want to continue testing, doing much more testing in our long-term care settings, doing more testing in schools, universities, and that's why we are continuing to add capacity. We also want to make sure that we have diversity in our testing platforms so that if we face a shortage like we did in April and May, or like we did a month ago, of any type of testing supplies, that our system is robust enough in Minnesota. We actually topped 30,000 tests reported over the weekend, so that's a very exciting milestone for one day. That was reported on Friday, or rather on Saturday for Friday. But we, with our new saliva lab, we're going to be upwards of 40 to 50,000 tests per day capacity in Minnesota. And that's really important to make sure we have good turnaround time, to make sure that we have all the testing capacity we need to serve the many needs of the state. Thank you.
Thank you.
Our next question comes from Peter Cox with Minnesota Public Radio. Your line's now open.
Yes, I'm wondering if MDH has any response to the comments from the mayor of Heighton over the weekend about the situation that happened there, I think September 15th, with people doing the Casper project.
Thanks, Peter. I'm going to ask Assistant Commissioner Huff to do that question.
Oh yeah, thank you, Peter. When staff reported this incident to us, we took it very seriously. We have no reason to doubt the details of their report. But this and reports of other incidents were serious enough that the CDC decided to pull their teams.
Following up, had you given the randomly selected communities a heads up that you would be there?
It's a great question. So we have done significant outreach with local public health and through you, our partners in the media, to let folks know about the study, that the study was occurring. We actually do not talk to specific communities in a Casper study. That's part of the research methodology. We want everyone to know that the study is happening. We don't talk specifically about where it will be happening with the community.
Thanks, Peter. There was nothing else related to that, right?
No, that's it, fine. Thanks.
Our next question comes from Chris Megan from Pioneer Press. Your line is now open.
Thanks. Just a quick follow-up, Commissioner Huff, on that icing question. Do you know of any? Was there more than one incident, I guess, down in that community or in that area? You say that you have no reason to doubt their report. Do you think that there may have been more than one encounter in that community?
We know of only one encounter that was reported in that community. We have other incidents that were reported in southern and central Minnesota. And again, those incidents collectively caused the CDC to remove their teams from the state.
And just to follow up on that, do you have any feeling or sense that pulling the teams out of the state was an overreaction in any way?
The priority in all of our work is for the safety of our staff. The staff were, I think, traumatized by many events that they experienced. We are very appreciative for the support that we've received from the CDC. We agree with them that putting their staff first is, and the safety of their staff is the most important thing. So I do not have any criticism of CDC in that position.
Thank you very much.
Our next question comes from Glenn Howitt from Star Tribune. Your line is now open.
Hi there. Speaking of outbreaks, do you have an update on the funeral in Barton County that you were talking about last week?
I do. I can get that data for you. So let me pull that up. And then, did you have another question?
Yeah. Any evidence that the recent uptick we've seen in cases, including another record-breaking day, does any of that link back to the Labor Day holiday weekend?
Yes. I mean, I think that what we're seeing in terms of our uptick in cases is both a combination of activities, related to that weekend, as well as just a general movement among the population to more and more activities that don't involve social distancing. So in other words, people are, we mentioned a more recent wedding, mentioned the funeral. We're seeing more and more instances where we have large groups gathering together with little or no social distancing and no masking, and all of those events are contributing to our case numbers, as well as, we talked a while ago about sort of the ripple effect. And so, you have an event and then that generates cases, but then each of those cases go back into an environment, a world, a social structure where they in turn generate more cases. So we're seeing sort of that building cumulative effect of lots of cases from clusters, as well as, the ripple effect of all those cases. And then Glenn, as soon as I pull up the data, I will speak up and share it.
Great, thank you.
Our next question comes from Megan Ryan from the Minneapolis Star. Your line is now open.
Hi, thank you very much. I have a question about testing capacity, maybe specifically related to college campuses. I'm curious if you guys know of any shortages of testing availability on any college campuses. And then if you could speak to, I know there's different philosophies, like for example, I think the University of Illinois is testing all of its on and off campus students every 2 weeks. I think at the University of Minnesota, it's only testing symptomatic students. And so I'm kind of curious if there's a kind of philosophy there of, why you think maybe one is right for one campus and not another.
Certainly, we have not heard of issues related to testing shortages. There have been testing events that have been made available in some of the communities where we have seen cases associated with colleges or universities. The department did not recommend, an ongoing continuous testing cycle for our higher ed institutions. Some certainly chose to do that, but that was not something that we were recommending. Although, as you said, some institutions are doing that. I think the intent is that you certainly want to be identifying cases early so that you can isolate and quarantine. But that also takes a huge number of resources. And so as more and more resources come online, that's something that can be considered. But that was not something that we had recommended at the beginning of the school year. And I don't know if Dan, you want to comment at all?
No, Chris, I don't have anything to add. Thank you.
Awesome. And then I just have one quick follow-up to that, which is, so kind of separately from students on college campuses, I guess specifically when referencing University of Minnesota and the Big Ten Conference, they're obviously starting to play sports again, and they're going to be doing daily testing of in-season athletes. And I'm curious if you guys know at all, having the daily testing being done, is there a possibility of that burdening the system at all, whether now or maybe, in the next month or so, if there's a possible surge?
Well, certainly, we recognize the important value that sports plays in all of our lives. And I live in a household where the return of various sporting activities to watch on TV has been a very welcome addition. But from a public health standpoint, obviously, our priorities would be that individuals who have been exposed to a case have the opportunity to be tested, that individuals who are symptomatic have the opportunity to be tested, and that we really prioritize testing for those populations. And certainly right now, the capacity that we have is allowing us to address multiple issues. But yes, if we got to a point where testing capacity was really in limited supply, public health might have a perspective on testing that might differ from some of the sports leadership. Great, thank you.
Our next question comes from Jake Benson from Proctor Journal. Your line is now open.
Thank you. Do you have any data or numbers for public school districts and students and staff that have contracted COVID?
Yes, we have a team that tracks that, and we have we've been watching. We look both at a situation in which there may be cases in a particular school. What we're finding is that most of the cases are not associated with transmission within the school setting, but rather are occurring external to school, sports or social, and then we're sort of doing the follow-up at the school level. The information that we have on schools will be coming out and be available on our website, I believe, this Thursday.
Thank you very much.
Next question comes from Tom Olson from Duluth News Tribune. Your line is now open.
Hi, thanks for taking my question. I'm just wondering, as we spend a fair amount of time on this call, hearing about social gatherings and events where there's a lot of potential for transmission. We have President Trump returning to the state on Wednesday. He's going to be in Duluth, potentially elsewhere, I believe, that day. I guess I'm just wondering, from your perspective, we still have guidelines on capping gatherings at certain numbers, and I'm just wondering how concerning it is to have have large scale rallies, and if there's any plans for monitoring or enforcing any of the actual guidelines around these events, especially knowing we still have another month and potentially more of these political events to come. So I guess I'm just wondering what the response to that has been, and if there's concern or any plan for enforcement around some of those events.
I think, as you know, Governor Walz did send a letter to both campaigns to let them know what the expectations were in Minnesota about, the size of groups, masking, social distancing, all of those things, and did ask for both campaigns to abide by that while they were in Minnesota. I think that Commissioner Malcolm has addressed the issue of enforcement on another call. So I'll kind of refer back to that. But certainly, anytime we have large groups gathering, and people are not socially distanced and not masking, that's always a risk for transmission, whether it's political or social. Any of those things are certainly concerning. And so, that's why we're asking the public to consider the guidelines when they find themselves in those settings.
Yeah, I mean, obviously I'm familiar with the letter, and I know that's been strongly recommended. I mean, are there any actual enforcement measures you could take, or things you could do, I don't know, at the event or after the fact, or is that kind of outside your control?
Well, I can tell you that I'm not responsible for enforcement actions. I can certainly see if Assistant Commissioner Huff wants to comment.
Okay.
Thanks, Chris. I think at this time we'll be monitoring. Again, I just want to reinforce what Governor Walz had said in his letter. We know that all the campaigns care about the health of their supporters, and we ask for them to make sure to structure and stage their events in such a way that is protective of the health and safety of everyone involved. I think, one of the things that Chris has mentioned multiple times, and I just think it bears repeating, if I am, young and healthy and feel, well, I'm not going to be impacted by the virus. One, we do know that that's still a risk, because we do have young, healthy people that are experiencing severe disease. But more importantly is it's an infectious, contagious disease. And therefore, if I contract it, even if I'm not personally negatively impacted, I can pass that on to other people who are more vulnerable. And I think and that's why we have really emphasized that for us to prevent continuing spread of this disease, it's important that we all take responsibility for protecting each other and for protecting the most vulnerable among us. Thank you.
Our next question comes from Chris Rogers from Winona Post. Your line is now open.
Thanks. Similar to the K-12 school question, MDH has talked about putting out a data tool for cases at colleges. Do you know when that will be ready?
Yes, thank you. The intent is that would also be coming out this week as well. We have been tracking what's happening in our institutions of higher education, and so that will also be going on the website coming up this week.
Do you know how often that'll be updated?
We'll be updating that weekly, but we also, obviously you're in a university town, and we're asking the colleges and universities to also be providing that information.
Thanks.
And then before we go to the next question, I just wanted to follow up with a question from Glenn Howitt related to the Martin County funeral situation. We are currently at a total of 39 cases associated with that event, with one person who is hospitalized.
Thanks, Chris. And operator, we have time for one more question. Yes, we have our last question from Paul Scott with Foreign News Service. Your line is now open.
Hi, I just wanted to see if you could address, it's quite a discrepancy in the two narratives regarding the Eitzen situation. The town official said there was no gun. There was a large radio that could have been mistaken as a gun. Clearly, whatever happened was bad enough to get the CDC teams to want to pull out, but is it possible, in your view, that the team confused a radio with a gun?
And I'll defer that to Assistant Commissioner Huff.
Thanks, Chris. So I don't want to, I guess, get in a tit for tat. I think we feel that the concerns raised by the team in the field were concerning. We acted at what we feel is the best for the safety of the team. We have no reason to doubt the veracity of their statement. I think that what's important for us to remember is a broader message that I think this the fact that the CDC pulled its teams from Minnesota. We know that people are frustrated, and we also know that some people don't agree with the policies that we have set forth. But it's really important to separate our frustration with policies, our frustration with the situation that we find ourselves in, and taking our frustration out on other people. I want to reiterate that the enemy is the virus, not each other. We're definitely concerned about the instance that that the CDC and Casper teams faced. We're concerned about instances that other public health officials in Minnesota and around the country have faced. I would ask that we all pause and remember that we are good folks here in Minnesota, and we take care of each other. And don't let the stress and the anxiety get the best of us, but to reach out and care for our neighbors and care for our fellow citizens. I think that is the bigger message here. Thank you.
Thank you.
Thank you. That's all the time we have for this afternoon. Thank you to our speakers and to the reporters on the call. And if you did not have a chance to get a question answered, please feel free to reach out to our office. Thank you all and have a good day.
You were just watching officials with the Minnesota Department of Health sharing the latest updates on the new coronavirus.